Welcome to the discussion of the question 2731 of the UWORLD Question Bank. Present symptoms include exertional dyspnea, difficulty falling asleep, bibasilar basal lung crackles. These three symptoms represent congestive heart failure with pulmonary edema. There is a displaced apical impulse. This indicates that the heart is enlarged. There is a systolic murmur at apex. This is most probably something related to mitral valve. It would be backflow since it's systolic and since it's seared at the apex. What's not present, absent symptoms include chest pain. There's no cough, there's no fever, and there's no hypotension, and there's no edema. Despite there is a congestive heart failure, but it happens progressively. So there must be a backflow from the lung into the right ventricle, into the jugular veins, and it might show as jugular venous distension and then peripheral edema. So that's why edema is not present. The process is progressive. The history of the patient include anterior myocardial infarction, and there was no revascularization due to time. The thing is, you need to revascularize during 90 minutes or 120 minutes if you are not in the facility provided with BCI. And I expect that thrombolysis was given. Thrombolysis is given if it's like 12 hours. And it's best given within 30 minutes. And that's for the mortality benefit. And you can wait 2 hours as well, and the mortality benefit will be high. But you can still give it anyways within the first 12 hours. It will still have some benefit. The patient was discharged after this anterior myocardial infarction incident, and he was prescribed dual antiplatelet therapy with aspirin and clopidogrel. He was given metoprolol as beta blocker. He was given lisinopril as ACE inhibitor. I'm not sure of the names of the drugs in the case, but that's how we continue after we have an incident of myocardial infarction overall. This is a takeover point. ECG findings include persistent ST elevations and deep Q waves. These findings mean that there is left ventricular aneurysm. These findings are consistent with left ventricular aneurysm. So these constellation of symptoms like heart failure and mitral regurg, slight mitral regurg, and displaced impulse, which means dilated ventricle, with this particular ECG finding, like persistent ST elevations and deep Q waves, indicate that there is left ventricular aneurysm. That's why this is the right answer. Pericarditis and effusion are excluded due to absence of pleuritic chest pain, and there is no fever. And auscultating the heart, there was just the murmur. If there was like friction rub, it would be mentioned in the question. Ischemia is also excluded because there was no chest pain. There are no new ECG changes. It's the same, and it takes few weeks to recover the ECG to get back to normal. It takes few weeks. So these findings are not something to worry about. It was already there when the first incident happened. Papillary muscle rupture is excluded due to absence of hypotension. Right ventricular myocardial infarction is also excluded due to absence of hypotension, and there is lung involvement. And if it's right ventricular myocardial infarction, there is no lung involvement. Like the pressure will backflow into the jugular veins and peripheral circulation, like into the liver and into the lower extremities. This is absent, it's not present. And free wall rupture as well. It's if the free wall ruptured, there will be hypotension. These things are excluded, so the right answer is left ventricular aneurysm. If you have any question, do not hesitate to leave it in the comments section. Thank you.